Duke-NUS Medical School was born when two world-class universities, Duke University and the National University of Singapore, came together to create a new medical school with a special mission: to transform the landscape in Singapore by producing a different kind of clinician and by driving innovative translational research. Our commitment to developing the SingHealth Duke-NUS Academic Medical Center has created a seamless bench-to-bedside research continuum with rich inspiration for our scientists while enabling clinicians of all stripes to fulfill their potential as Clinicians Plus. On top of our research-focused Doctor of Medicine curriculum, we offer some of the top PhD programs in Asia designed to boost Singapore's capabilities in key emerging biomedical fields. We also have conditional admissions pathways with top universities in the world, providing select students with opportunities to pursue diverse academic interests while also actively engaging the medical community at Duke-NUS. As for our students, their diverse academic backgrounds and unique life experiences bring a rich diversity to our school and the wider medical community.
I came to Duke-NUS with a degree in biotechnology and business from the Hong Kong University of Science and Technology. I chose to study other fields to widen my horizons before pursuing my dreams of studying medicine.
I studied material science and engineering at Nanyang Technological University before coming into Duke-NUS. But through my volunteer work with rehabilitation programs, I realized that I not only want to do medical research, but also hope to have a more direct impact on humans.
At Duke-NUS, a great part about the curriculum is putting the role of learning onto the students. This system, called Team Lead, it encourages active participation in group discussions, and I learn from my teammates' different perspectives. This teamwork-oriented approach prepares us well for the naturally collaborative nature of medicine.
To learn and practice our clinical skills, we have a dedicated simulated learning space that provides us with an environment that is lifelike and allows us to hone our skills without being afraid of making mistakes.
We also have the anatomist table, where we can virtually dissect a real human body and study the intricacies of human anatomy.
My experience at Duke-NUS is really useful for me because we have people working on various diseases and disorders, both from the very basic levels all the way up to a really translational level as in actively developing treatments. And having that perspective of basic translational research, I think will be very helpful for me in the future as a scientist. And as PhD students, we get to work in the labs under the guidance of internationally recognized faculty who give us direct support in our thesis research.
I like to think of Duke-NUS as a small but mighty research powerhouse on the little red dot, where our scientists tackle the most pressing healthcare challenges through basic and translational research, focusing on diseases affecting Southeast Asia to the benefit of patients here in Singapore and around the world. Since day one, our scientists have focused on making discoveries that impact the major public health challenges in Singapore through our 5 signature research programs. In the fight against COVID-19, our experts in infectious diseases working with local and international partners impacted the fight against the pandemic in Singapore and around the world. This includes being among the first institutions worldwide to isolate the virus and developing the first neutralizing antibody test for SARS-CoV-2, allowing rapid and specific confirmation of infection, as well as assessment of immune response to vaccination. A range of impactful research discoveries has been made by scientists at Duke-NUS, who have been recognized with top local and international honors.
What drives me to keep innovating, to me, is really trying to constantly find solutions to improve patient outcomes. Trained as an engineer, and then after that now as a surgeon, I really wanted to come up with my own devices and to help patients basically. Our Centre of Technology and Development, or CTED, works closely with researchers and entrepreneurial players in Singapore. I actually really enjoy that process of bringing different multidisciplinary teams together to solve an unmet clinical need, to actually create solutions that improve patient outcomes. Through its innovative education program that emphasizes critical thinking skills, clinical training, and research, Duke-NUS has prepared and given me the opportunity to pursue my passion in both surgery and medical device innovation.
Delivering clinical care is team-based. It is multi-disciplinary, it is interprofessional, and multi-institutional. And as I grow and develop into my role as a Clinicians Plus, I'm confident that the AMC partnership will continue to provide me with the resources and opportunities I need to achieve my goals. Moving forward, it will be interesting to see where we are headed in terms of collaborations, both within Singapore as well as globally, as we aim to provide the best medical care to our patients with the latest medical innovations as well as groundbreaking clinical trials.
Together with our academic medicine partner, SingHealth, we have created a vibrant biomedical ecosystem, combining research, education, and patient care, enabling our students, scientists, and clinicians to transform medicine and improve lives.